Hello, and welcome to the Associate of Science in Radiography program at Allen College. My name is Kara Howard, and I am an assistant professor with the ASR program. I hope you enjoy learning about this program and the radiography profession as you navigate through the radiography presentation and videos. If you are unable to chat with the ASR faculty today, please email any questions you may have, and we will be happy to assist you. Thank you. Welcome to the Associate of Science in Radiography program at Allen College. This program is a great foundation for anyone who is wanting to begin a career in healthcare. Patients may often refer to us as nurses, but we can be known as a radiologic technologist, a radiographer, or an X-ray technologist. Let's begin by talking about the discovery of X radiation. X is the symbol for the unknown. In 1895, Röntgen discovered all of the properties of X-rays that we know today. To test his discovery, Röntgen made an X-ray image of his wife's hand. You can see on the image that this X-ray shows the bones in her hand along with the ring she was wearing. For a time, they were called Röntgen rays, but X-rays was and has remained the most popular term for this type of electromagnetic radiation. Now let's learn about the roles and responsibilities of a radiographer in the healthcare setting. When a radiographer is going to take an X-ray of a patient, there is a process that must be followed. Imagine you are working at a hospital and you find out that there is a patient that just arrived for a chest X-ray. What do you think you will need to do first? To start the process, you must first greet your patient and introduce yourself. If the patient is wearing any type of clothing that could interfere with the exam, you will want to have them change into a gown. Next, you will document the patient history, verify that you have the correct order, and explain the exam to the patient in case they have any questions for you before you begin. As you are positioning your patient, you will assess the patient's condition and provide direct patient care. You will then safely operate the X-ray equipment to produce a radiograph or an X-ray image. After you verify the quality of the images, you will send them to a radiologist for interpretation. You may also have the responsibility of assisting the radiologist with advanced procedures. As you can see, a radiographer has many roles and responsibilities. Have you ever walked through a radiology department or talked with a radiographer before? The best way to learn more about the profession is to schedule a job shadow through a hospital near you. If you live near the Waterloo-Cedar Falls area in Iowa, you have several hospital options if you would like to job shadow. In Waterloo, you could contact the radiology department at Allen or Mercy One. At both of these hospitals, you may have the ability to talk with our radiography students and watch real patient exams. Other nearby hospitals are located in Waverly, Charles City, Marshalltown, Vinton, Independence, and Grundy Center. All you need to do is call the main hospital number and ask to speak with radiology. Next, let's look at some of the equipment that radiographers use to X-ray patients. Technologists can perform exams with the patient on the table, standing upright or sitting upright, laying or sitting on a stretcher, or in a wheelchair. This image shows you what a diagnostic X-ray room typically looks like. Notice that the X-ray tube is suspended over the X-ray table. This X-ray tube can be moved freely around the room to accommodate those patients who cannot be examined on the table. A portable X-ray machine can be used for bedside exams in the patient's hospital room, emergency room, operating room, and the recovery room after surgery. The patient does not have to come to the radiology department to get an X-ray taken. A radiologist can use fluoroscopy to view anatomy in real time on a monitor. During this type of procedure, the technologist is still responsible for preparing the patient and equipment, as well as assisting the radiologist while they perform the exam. The portable C-arm can be used in various ways, but most commonly it is used in a sterile environment like the surgical operating room. The technologist who operates the C-arm in the operating room must wear proper surgical attire and help maintain the sterile field when assisting the surgeon. When the technologist is in the room while the X-ray equipment is being used, they must always wear a lead apron and thyroid shield. Now that we have talked about the equipment that the technologists use, let's discuss the radiography program here at Allen College. The radiography program is a 6-semester JRCERT accredited program that includes classroom, lab, and clinical instruction. 24 students are admitted each year, with the program starting in late July or early August. You may apply to this program as a senior in high school. There are no college prerequisite courses required before you can apply. When you complete the program, you may be eligible to apply to take the ARRT certification exam. You must pass the ARRT certification exam and be of good moral character to obtain a permit to practice in the state of Iowa and 34 other states. Here is a list of radiography websites that you can use to obtain more information. Becoming a registered radiologic technologist will create a solid foundation with several advancement opportunities. The radiology department encompasses a wide variety of modalities that include radiography, CT, MRI, mammography, interventional, nuclear medicine, and ultrasound. The radiography program here at Allen College will provide you with the foundation necessary to begin a career in radiography, where you will have the opportunity to cross-train in other modalities, consider various bachelor's degree programs, or even become an educator. Next, let's look at some of the common diagnostic X-ray exams that we perform in general radiography. A chest X-ray is the most common exam performed. X-rays can be taken to look at a lot of different things, not just broken bones. These images show you what a normal knee looks like compared to a knee that has arthritis. The blue arrows are pointing to what a normal joint space in the knee should look like. The red arrows show a loss of joint space. These are images of the hip. The image on the right is showing you what a total hip replacement looks like after surgery. The two images on the left are showing you the before and after images of someone who had pins placed in their hip to fix a fracture. The technologist will assist the radiologist during fluoroscopy exams. The esophagram and barium enema procedures are conducted using a contrast called barium. During an esophagram procedure, the patient will put the barium in their mouth, and the radiologist will take image as the patient swallows the barium. X-rays are absorbed by the barium due to its high atomic number, so it can easily be seen on the image as it outlines the esophagus. The barium enema procedure also uses barium, but the barium is inserted into the large intestine through a rectal enema tip. Similar to the esophagram, the barium can easily be seen as it outlines the colon. Radiography students also have the opportunity to learn about venipuncture. There are different types of contrast used in the radiology department. The intravenous urogram uses a contrast that is injected through an IV. This contrast is then filtered through the kidneys and down into the bladder. This type of procedure is beneficial in showing stones or any kind of obstruction in the urinary system. Look at the image on the left. What foreign object do you see? If you guessed coins, you would be correct. This is a chest x-ray image of a toddler who swallowed a few coins. Now look at the image on the right. This is a foot x-ray. What foreign object do you see here? If you guessed a sewing needle, you would be correct. Oftentimes, we have patients come to the emergency room due to an accident or injury. The image on the left is of a fractured humerus. The image on the right is of a dislocated shoulder. Do you know what body part we are looking at here? These are images of a wrist. On the left, you will see what a normal wrist will look like on an x-ray. The image on the right is showing a fracture to the distal radius. Some fractures require a splint or cast, while others require surgery. Next, let's look at an image of a wrist after surgery. Here is a wrist that had a plate and screws inserted during surgery to hold the bones in the proper place. The portable C-arm is shown on the right. This is the x-ray equipment that is used by the technologist to assist with the surgical procedure. Let's finish up by talking a little bit about CT and MRI. CT, or CAT scan, is short for computed tomography. This machine uses x-rays and a computer to image the body as the patient moves in and out of the circular opening. CT is superior at imaging the brain, spine, chest, abdomen, and pelvis. It can also perform advanced imaging, such as looking at blood vessels in the head, abdomen, and the heart. Due to its ability to create accurate images in a short amount of time, CT is often used during trauma situations. A series of X-ray images, like slices of bread, are put together by a computer to form a 3D view of the body. MRI stands for magnetic resonance imaging. The MRI equipment looks similar to the CT equipment, but it does not use any type of radiation. MRI uses powerful magnets, radio waves, and the hydrogen in your body to create an image. MRI is great at imaging areas of the body like the brain and spine that are surrounded by bone and made mostly of water. Compared to CT, it takes a lot longer to acquire an MRI image. A typical MRI exam will take about 25 to 45 minutes to complete.